how do we resolve financing of healthcare? And how do we resolve it for families and for employers, for enterprises, for institutions? And the answer that we've come up with is Checkups Cova. So what we are is a finance-embedded health care benefits management platform. What does that mean? We help enterprises, institutions, companies, employers, businesses to finance, to pay for, to manage healthcare benefits, to pass them on to their employees, and then for their employees to share them with whoever they want, African style. What do I mean by African style? We recognize that the structure of our family is not the commonly defined nuclear family. The person who works or who runs a business today will be the person who will be looked to by the rest of the family members, including extended family, parents, grandparents, aunts, uncles, cousins, nephews, nieces, but not just that, within the community in which they are, by their own employees and by the people within their community for help when there's a healthcare bill. So can we be able to unlock the health benefits and allow the person who has been able to access them to distribute them and pretty much to share them with whoever is within their ecosystem that they need? That's what we mean by African style. And the answer is yes. And so when we enable that distribution on our platform, now here's our magic formula. We come back to the question of cost. So we ask ourselves, how do we create the greatest value for that healthcare benefit? If you are buying the healthcare benefits in Kenya, you will pay 100 shillings or 1,000 shillings. But if you take that 1,000 shillings out into the market, you will be subject to the vagaries of the price of the market. How do we take that same 1,000 and give you the best value? We figured the formula, and so we 4x the money that is paid onto our platform so that you get 4 times more value compared to the market rate. So your 1,000 shillings in this case becomes 4,000 shillings worth of healthcare benefits that you can distribute with whoever it is that you need. No exclusions because of age, no exclusions because of pre-existing conditions, no wait time between when you pay and when you can begin to enjoy the benefits. And like I said, you can distribute them with whoever you want. And this way, we unlock the question of financing and then the question of distribution, which are the two challenges that presently are the greatest barriers to being able to achieve some kind of universal healthcare.